pure zirconium?
Yes. And it, quite frankly, has good data. The one issue that remains, research data that we need to see, in my opinion, on zirconia is what it does to our immune system. In other words, there's not good immunological data on embedding zirconia implants into bone. Because of the patient group that I typically see who are trying to avoid anything that might be a challenge to their immune system, we choose not to use those. So what would we use? How are we going to replace a tooth and try not to challenge someone's immune system? The way we do it currently is to put some sort of a bonded, fixed bridge work into the patient's mouth. Hopefully, the patient has teeth on either side of where they've had a tooth removed, and we can simply bond a tooth in without having to alter the teeth on either side. In other words, without having to grind them down for a conventional bridge. And then the next choice is, if we don't have that option available to us, we will make the patient some sort of an aesthetic, very aesthetic, removable appliance. And our hope is that within the next few years, we have a completely biocompatible implant.
Is that being worked on?
It is being worked on. In fact, results from a recent research study at Columbia University in New York were just released, whereby a collagen frame that almost looks the shape of a tooth can be embedded into the jawbone, the patient's own stem cell introduced into that framework, and grow the entire tooth. So the article mentioned that patents were being sought after currently by Columbia University in order to get this procedure patented. It made me believe that it wouldn't be long before we have that option available to us.
And then the material would be DNA tested, or what?
Then the material would literally be the patient's own tissues. Collagen framework would simply reabsorb, but the stem cell from the patient would literally reproduce a tooth.
Wow.
Yes. This research was pioneered first in pigs, and 2 years ago, researchers grew the root of a tooth from the pig's own stem cell in the pig's jaw. Unfortunately, they did not get the entire tooth, but work was being done by that group, and there's work going on now around the world to try to utilize a patient's own stem cell to reproduce teeth.
It's remarkable.
Truly.
Do you think it's going to take a long time getting approval?
In my mind, I think it's probably not something that we're going to see in the next 3 or 4 years, but hopefully within the next 5 to 10 years, it'll be a routine procedure and we'll be able to abandon titanium and other implants that don't have the patient's own DNA written into them.
What do you think about titanium hips?
Great question. I think there's some difference between titanium that's embedded into an area that does not have ready access to bacteria. See, the implants that we embed into the tissues in the mouth are privy to the bacteria that are in our mouth. And so, although the implant success rate in this country in terms of dental implants is great, above 90% of those implants make it long past 5 years, the issue that we have not looked at is what sort of challenge are those to our immune system during the time. Just in the same way that we haven't looked at root canal teeth in that same way. We've looked at root canal teeth as being successful because the patient keeps the tooth for a number of years and it even maybe remains asymptomatic, so the patient can hardly tell the difference between it and any other tooth. But what are the challenges during that time to the patient's immune system?
Can you talk a little bit about the way that you clean patients' teeth in your office? I thought it was really refreshing and quite different, and I've never been through anything like that. Can you talk to the audience about why you do what you do?
The first thing that we do in our office before we clean a patient's teeth is we take a sample of the bacteria that are under the gum line. For years, I practiced without a microscope, and now I couldn't practice a minute without a microscope. The microscope allows us to look and see exactly what bacteria are under a patient's gum line. Some people will go to the dentist, and I have patients like this for years, and they'll say, I'm brushing and flossing, and still my gum tissues are inflamed. And we would notice that. Their mouths would be clean, but their tissues never looked healthy. Well, now we can identify why that is, and that's because they have a certain type of bacteria under the gum line that continually keeps the tissue inflamed. It bleeds in spite of their efforts to keep their teeth clean. So that's the first thing. And the next thing is that, of course, our hygienists will go around and clean in the customary way, and they'll certainly use ultrasonics and hand scaling instruments to get the teeth clean. But what we do to really top the procedure off is that we use a little syringe full of ozone to go around. It's delivered through a machine. We use this ozone machine to deliver little micromolars of ozone into the pocket, into that little crevice between the gum and the tooth. And that literally sterilizes that pocket. It just cleans out all of those bad bacteria. And we love to go back and take another sample of that and look at it under the microscope and see that there's just hardly anything left. And so that really is what I think distinguishes our periodontal department from most other traditional dentists, in that we're using a microscope and we're using ozone. Ozone gets a bad rap because we're all aware of ozone action days, and we think, gosh, ozone, that must be awful. The truth of the matter is ozone is there to protect us. And the reason we are told to stay inside on an ozone action day is because ozone is easily measured in the atmosphere. It comes down and literally helps clean up the toxicities in the atmosphere, but it's not the ozone itself. If it weren't for ozone, we'd all be dead from the toxicities that pollute this earth. So ozone is tremendously beneficial. There are no known bad side effects to using it, and it really does help clean up the bacteria in the mouth.
Can you also talk about your philosophy of flossing versus or in addition to a water pick, and how you're recommending in the meantime that we're doing our oral care?
Well, it's interesting that the bacteria that are in our mouth and under the gum line are very difficult to get to with floss and toothbrushing. They're just a little too deep. But we are very fond of water picking. Water pick, especially if you have the right tip on it, which is a very pointed rubber tip. If you can take that pointed rubber tip on a water pick and put it under the gum line, you can literally flush the bacteria out. And one of the most effective things to do with a water pick is to take an ounce of organic apple cider vinegar, put that in the water reservoir with about 7 ounces of water, and now you have a wonderful solution to help eliminate the bacteria under the gum line. Most of our patients who have bacterial problems, we will suggest that solution right there. Bragg's good old organic apple cider vinegar, 1 ounce of that to 7 ounces of water is a terrific solution to irrigate your teeth with.
Why the apple cider vinegar? What does it do?
The apple cider vinegar alters the pH in the environment there, and those bacteria do not appreciate that at all. And so they're either dead on contact or they scatter.
You're subtle, doctor. You're subtle. You're killing the bacteria, but you're telling us they won't like it at all.
You're right.
I'd hate to have you mad at me. Is there any other material that people can use if it's not apple cider vinegar? Have you found anything else beside that?
All sorts of things have been used, and even diluted solutions of bleach are effective, but we're not fond of chlorine solutions. We really don't recommend that. I think the apple cider vinegar is the best. Another very, very good one is to take a gram or two of powdered vitamin C, put that into the water pick, stir that up until you have a nice solution of it, and irrigate with that. That's also a very effective way to control those bacteria.
How often do you do it, and how often do you recommend to patients to do this? Once a day, twice a day?
I'd recommend it once a day. Now, there are some patients who have struggled and who have such deep